अस्सलाम वालेकुम। कैसे हैं आप लोग? I hope so you are all fine. I'm Dr. Mohammad Ali Rabbani, Assistant Professor of Anatomy, and today we are going to discuss cranial nerves. As you can see from the topic, it is going to be a large lecture, a long lecture. Recording will be available through the same YouTube link. You can save this link and visit us later. And meanwhile, for those people who are live with us, you can put your queries in the chat box. I will try to answer them as we go along. So let us jump into it. Let us start our lecture of cranial nerves. Bismillahir Rahmanir Rahim. What are cranial nerves? Simply the nerves exiting from the brain and brainstem. How many are there? There are 12 pairs. There is olfactory, optic, oculomotor, trochlear, trigeminal, abducent, facial, vestibulocochlear, glossopharyngeal, vagus, accessory, hypoglossal. These are 12 cranial nerves. By all means, you should remember the names of all them in addition to their numbers. Both are necessary. How are they classified? Functionally, they can be classified as sensory, motor, and mixed. The sensory ones, just try to think of the special senses. What are the special senses? Hearing, vision, then smell and taste. Apart from taste, smelling, olfactory nerve, seeing, optic nerve, hearing, oculomotor nerve, sorry, vestibulocochlear nerve, these are all pure sensory nerves. Motor nerves, they mostly include the three nerves that are responsible for the movement of extraocular muscles: oculomotor nerve, trochlear nerve, abductor nerve. That nerve that is responsible for the movement of two muscles, sternocleidomastoid and trapezius, spinal accessory nerve, and the nerve that is responsible for the movement of muscles of the tongue, hypoglossal nerve. These are pure motor nerves. The other nerves that we are left with are mixed cranial nerves: trigeminal, facial, glossopharyngeal, and vagus. I have also included cranial part of accessory nerve. The same nerves can be seen from the perspective of embryology. So the special sensory, special afferent fibers are the ones that are pure sensory nerves. Pure motor nerves are mostly the ones that are general somatic efferent nerves. Don't worry, we will discuss the types of fibers also. So most of the, apart from the parasympathetic part of the oculomotor nerve and the spinal part of accessory nerve. And if you have already figured it out, the mixed nerves include the nerves that are supplying the pharyngeal arches, special visceral efferent nerves. So these are the nerves of the four arches respectively. And here I must add 4 plus 6th arch. These are the nerves of the 4th plus 6th arch. This is a quick summary. You can take a screenshot and this is taken from Gray's Atlas. These are the quick summary of the nerves. Olfactory nerves, sensory, shown by blue for sense of smell. We'll go from here. Optic nerve, pure sensory for the vision. Oculomotor nerve, two parts. The part that is somatic, that is supplying the 5 extraocular muscles, and the part that is visceral is supplying the ciliary muscles, constrictor, pupillary muscles. Then there comes the two other extraocular muscle supplying nerves, trochlear and abductor nerves. Then comes the facial nerve. Facial nerve is having both the sensory and motor components. Most of the sensory supply of the face is from this nerve, and there are 8 muscles, we will discuss them, that are being supplied by trigeminal nerve motor component. The chief muscles including the muscles of mastication. These are 6 nerves. Let's start with the 7. This is a very big nerve. We will go into the detail. It is basically supplying all of the muscles of facial expressions. There are a bunch of other muscles also, and it has a large parasympathetic supply, including the supply of these two salivary glands and the lacrimal gland also. And it is responsible for the parasympathetic supply of nasal and palatine mucosa. Then we come to the vestibulocochlear nerve. This is the nerve is having two parts. The vestibular part that is responsible for the balance, movement, and then there is cochlear part that is responsible for hearing. Then comes the glossopharyngeal nerve. This nerve is having sensory and motor components. The sensory component is mostly the oropharynx and back of the tongue, general and special sensations, and the motor sensation is only one nerve. Then comes the vagus. It's a very big nerve in terms of distribution. Okay, let us continue from here. So we were talking about accessory nerve, spinal accessory nerve, and this is the nerve that is responsible for the sternocleidomastoid and trapezius. And then we come to the hypoglossal nerve, that is the nerve that supply the tongue. Okay, before starting the nerves themselves, let us discuss a few things. Let us discuss a few preamble functional components of the cranial nerves. If we talk about the sensory nerves, the afferent nerves, these are general, somatic, afferent. These are all the sensations that you are perceiving consciously from the body, from the skin, like touch, temperature, vibration, proprioception, all these things. Special somatic afferent, it is related to the special senses, and somatic means it is pertaining to the hearing, balance, and vision. So the innervation from the cranial nerve number 2 and cranial nerve number 8 will be included in that. General visceral afferent will be from the all visceral sensations. For the cases of head and neck, we will be discussing the impulses from the carotid sinus, carotid body. In the case of the abdomen pelvis, the impulses, the innervation from all of the abdominal viscera, the different reflexes that are responsible there. And special visceral afferent, by exclusion, the nerves we are left, the senses we are left with, that is the sense of smell, the sense of taste. The sense of taste is distributed among at least 2 to 3 nerves: facial nerve, glossopharyngeal nerve, and vagus nerve. We will discuss them. And the sense of smell is through the olfactory nerve, cranial nerve number 1. Then we come to the efferent fibers. General somatic efferent fibers are the skeletal muscle fibers that are innervated, the efferent fibers that are under our conscious control. So this includes majorly the muscles of extraocular movements and the tongue, the muscles of the tongue. General visceral efferent, this includes the autonomic outflow. In general, the general visceral efferent will include both the sympathetic and parasympathetic, but in the case of cranial nerves, we will only include the parasympathetic, because the parasympathetic cranial nerves only has that outflow from the cranial nerve 3, 7, 9, 10. And then we are left with special visceral efferent. In the 2 slides behind, we talked about the 4 mixed cranial nerves that are supplying the areas developed from pharyngeal arches. So these are the fibers that are going to supply the muscles derived from pharyngeal arches. So that's about the functional components. They will have their different nuclei, and if a cranial nerve has more than one functional components, each functional component will be derived from its own nucleus. They have a particular arrangement in the brainstem. This is a picture taken from Inderbir Singh Neuroanatomy. This shows their arrangement. Let us break it down. This is the medial aspect. This is the lateral aspect. So when talking about this arrangement, in general, all of the motor fibers, motor nuclei are usually towards the midline. They are towards the medial aspect, and The sensory components are mostly towards the lateral aspect, shown by the red and blue colors respectively. And the line that is demarcating the two, it's called sulcus limitans. So this is the same thing we discussed. So the motor nuclei are on the medial aspect and the sensory nuclei are on the lateral aspect. And if you're able to see all these, I have removed the only efferent components. You can see all of these nuclei will be efferents. Let's move on. Now, within all the efferent nuclei and now within all the afferent nuclei, we are going to divide it further. Within all the efferents and within all the afferents, within each half, visceral nuclei are nearer to the sulcus limitans and somatic nuclei are away from the sulcus limitans. So you can see here, the visceral nuclei or the motor system are near the sulcus limitans, somatic is away, and the same goes true for the sensory nuclei. The visceral are the near one and the somatic one are the far ones. Moving on, then we are left with general and special. Within each category, now we had four categories: general, visceral efferent, visceral afferent, somatic efferent, somatic afferent. Within each category, the general one will be nearer to the sulcus limitans and special one will be away from it. So here you can see there are two special afferents. The general one will be nearer to it, special one will be away from it. So there are two visceral efferents. General one is here, special one is there. And here you can see two interesting things. For the general somatic efferents, there is no counterpart special somatic efferent. There is no counterpart special somatic efferent. This is alone. And here is the other thing to be noticed. There is a common nucleus for the general visceral afferent and special visceral afferent. They are two separate sensations, they are two special modalities, but they are sharing a common nucleus. So that's all about the arrangement and the functional components. Just to give you a preview, you must have done neuroanatomy and you must have drawn these pictures sometime in your student life. So these arrangements not so much clear, but they are visible. For example, in the case of medulla, hypoglossal nucleus, it's present in the near the midline. Then there is special visceral efferent nucleus ambiguous. Then there is general visceral efferent dorsal vagus parasympathetic nucleus. Then comes the solitary nucleus. Then comes the spinal nucleus from the general somatic afferent and the vestibular and cochlear nuclei laterally. So they are arranged in the same manner. So there you will see different pictures like these that will be showing these arrangements. So this is all about the arrangements, and a point to remember is that one nucleus can be supplying more than one cranial nerves. For example, nucleus ambiguous here, here it is supplying 9, 10, and 11 nerves. At the same time, one cranial nerve can be connected to more than one nuclei. For example, facial nerve will be getting its motor fibers from here. It will be getting its parasympathetic fibers from here. It will be getting its taste fibers from here. So it may be having a different sources. We are just about to start cranial nerves themselves. I'm about to end the preamble now. Before preamble starting, few more things. Cranial, we will talk about the motor nuclei, sensory nuclei, and the parasympathetic nuclei, their connections from the higher centers. The cranial nerve nuclei, they are similar to the or to the alpha motor neurons in spinal cord in the way that both are lower motor neurons. They are similar in this way. They are both lower motor neurons. They are similar in this way. However, they are different in the way that alpha motor neuron, it is only being supplied by the contralateral cerebral hemisphere. However, the cranial nerve nuclei, it is being supplied by the both hemispheres. This fact is important because if there is a stroke on one of the cerebral hemisphere, the lower motor neuron will definitely go into the palsy, upper motor neuron type palsy, contralateral side. However, the cranial nerve is likely to survive because the same sided cerebral hemisphere will support it. Of course, that it is not a solid rule. There are a few exceptions here. We will talk about two exceptions during the course of this lecture. We will talk about part of cranial nerve number 7 nuclei, and we will talk about part of cranial nerve number 12 nucleus. We will talk about these exceptions, but I'm not talking about them right now. So these are all lower motor neurons we discussed. Then the parasympathetic nucleus I want to talk about. There are four parasympathetic nuclei present in the brainstem that are exiting to cranial nerves. As you might have already studied, the parasympathetic system always consists of two neurons arranged in series. There is always a pre and then a post neuron. Pre one is called presynaptic or preganglionic, and the same goes for the postsynaptic. And the same rule pertains that the presynaptic preganglionic will be always inside CNS. In this case, it will be brainstem, and postsynaptic will be always in the peripheral nervous system. In this case, it will be different ganglia that you will see: ciliary ganglion, OT ganglion, pterygopalatine ganglion. These will be different ganglion, submandibular ganglion you will see. So all of the parasympathetic nuclei that you will see in the cross section of the brainstem will be preganglionic, presympathetic. Then we are left with the sensory system. This is a picture from Kaplan's neuroanatomy. This is a picture for the spinal cord ascending tracts. I am just putting it here to compare it with the sensory systems of the cranial nerves. There you talked about three order neuron system. There was first order neuron whose cell body was outside. It was taking impulses from the receptor, and it was ending on the same side. Then there was second order neuron. It was on the ipsilateral side as the first order neuron. It always crossed the midline, and it always ended in the thalamus. In the case of spinal cord, ventroposterolateral. And the third order neuron was the one that was always present in the thalamus, and it went up and went to the different areas. The same situation, the same setup occur for the cranial nerves. So cranial nerves will have first order neuron in the nucleus, in the ganglion outside. Here there will be no dorsal root ganglion, there will be cranial nerve ganglion. The second order neuron will be on the ipsilateral side within the sensory nucleus. The second order neuron will always cross the midline, and the third order neuron will be always in the thalamus. In this case, it will be ventro-postero-medial nucleus. So the same situation goes on. And so the sensory nuclei of the brainstem are basically which neurons? These are all the brainstem nuclei. These are the second order neuron in the pathway. These are second order neurons in the pathway. And that is true for the general and special senses. Then you are encountered with a question that where the cranial nerves exit from the brain. We will discuss them with a lecture with each of the cranial nerves individually. But in general, the first two cranial nerves are originating from the forebrain, from the telencephalon olfactory nerve, from the diencephalon the optic nerve, from the midbrain third and fourth is exiting, from the pons there is 5, 6, 7, 8, and from the medulla oblongata there will be 9, 10, 11, 12. we will go into a little detail as we go through each of these nerves. So these are the two pictures from the Netter's Atlas that I will be referring to them frequently. I will be showing this is the frontal view of the brainstem, and this is the posterior view, dorsal view of the brainstem, and these will be the views that we will be discussing regularly. Okay, then you are encountered with a question. You are encountered with a question regarding their exit from the skull. Their exit from the skull. So, from which foramina do these nerves exit? I'm leaving the picture here. This is from the first aid and from a USMLE preparation first aid book. And here, this year the picture is here, and I will quickly go through them. The first cranial nerve goes through the cribriform plate. Second cranial nerves go through the optic canal. Third one, fourth one, sixth one are going through the superior orbital fissure. Fifth one is divided into three parts of thalamic division, maxillary division, and mandibular division, denoted by V1, V2, and V3. These are exiting through superior orbital fissure, foramen rotundum, and ovale, respectively. Then there is eighth and seventh and eighth are exiting in the towards the inner ear. 9, 10, 11 they are exiting through jugular foramen, and 12 is exiting through um, its own canal, the name of hypoglossal canal. With this large preamble,